Here is something your doctor has probably never said to you out loud. Your blood sugar does not stay high because you are eating too much. In many cases, it stays high because your body has stopped responding to the hormone that is supposed to bring it down. And that is a completely different problem. One that no amount of skipping meals or cutting out bread will fully fix on its own. My name is Dr. Joseph Collins. I am a medical health educator, and I've spent years working with patients who are doing everything they were told, counting calories, avoiding carbohydrates, taking their medication, and still watching their numbers stay stubbornly high. Not because they were failing, because they were missing 4 specific foods that work at the root of the problem. I'm going to walk you through all 4 of them today, what each one does inside your body, the science behind it, and exactly how to use it. No guesswork, no extreme diets, just 4 things you can add to your meals, starting today, that give your body what it needs to bring those numbers down and keep them there. Stay with me through all 4, because the last one surprises almost everyone who hears it. And before we go further, if you are someone who wants real explanations, not just a quick tip and a prescription, or you, hit subscribe and turn on the bell. Leave me a comment below telling me what your blood sugar reading was this morning. I read every single one, and your numbers shape the topics I cover next. Now, to understand why these 4 foods work, you need to understand what's actually happening when blood sugar stays high. Inside your body, there is a hormone called insulin. Insulin's job is straightforward. Every time you eat glucose, the sugar from your food enters your bloodstream. Insulin is what moves that glucose out of your blood and into your cells, where your body burns it for energy. That process works exactly the way it should, until it doesn't. When a person spends years eating foods that cause frequent, sharp spikes in blood sugar, the cells eventually stop responding to insulin's signal. Insulin arrives, it does everything it is supposed to do, and the cells simply do not answer. We call this insulin resistance. Your pancreas then produces more insulin to compensate. Your blood sugar stays elevated regardless, and the standard clinical response is more medication. What almost never gets explained in a standard appointment is this. Certain foods contain natural compounds that can speak directly to those resistant cells, not by forcing the issue the way medication does, but by calming the inflammation that caused the resistance in the first place, by slowing how fast glucose enters the bloodstream, and by helping your cells respond to insulin the way they were designed to. That is what these 4 foods do. Each one targets a different part of the problem, and when you combine them the right way, the effect compounds. Your body starts doing the work it was always meant to do. The first food is bitter melon. It is a dark green, ridged vegetable, and if you have never heard of it, that is exactly the problem. Bitter melon has been used medicinally across Asia, Africa, and the Caribbean for generations. But Western clinical practice largely overlooked it, until the research caught up. Here is what makes it remarkable. Bitter melon contains 3 active compounds, charantin, vicine, and a substance called polypeptide P, that work together in a way no other common vegetable does. Charantin has been shown to lower blood glucose in multiple clinical studies. Polypeptide P behaves similarly to insulin itself, helping your cells pull glucose out of the bloodstream without requiring your pancreas to produce more of the hormone your cells are already ignoring. A study published in the Journal of Ethnopharmacology found that bitter melon extract significantly reduced fasting blood glucose levels in participants with type 2 diabetes. The effect was measurable within weeks. In plain terms, bitter melon does not mask the problem. It helps your body correct it. You can find it fresh in most Caribbean or Asian grocery stores. Slice it thin, lightly saute it with a little olive oil and garlic, and serve it as a side. If the bitterness is too sharp for you, bitter melon is also available as a supplement capsule, but the fresh or lightly cooked form retains more of its active compounds. Start with a small amount and work up gradually. This is a powerful food, and your digestive system may need a week to adjust. One important note before we move to the second food. If you are currently on medication for blood sugar, whether that is metformin, a sulfonylurea, or insulin, please monitor your readings closely when you add bitter melon and talk to your doctor before making it a daily habit. Not because bitter melon is dangerous, but because it works. It can lower your sugar enough that your current medication dose may become too strong. That is a conversation worth having with your physician before it becomes a problem. Now, the second food is one you have almost certainly already heard of, but what you probably have not heard is the specific form of it that actually makes a difference, and the one most people buy that does almost nothing at all. The second food is cinnamon, and before you move past this one because you already have it in your kitchen, stay with me, because the cinnamon sitting in most people's spice rack is not the kind that moves blood sugar numbers. There are two entirely different varieties, and they are not interchangeable. The cinnamon sold in most grocery stores under generic labels is called cassia cinnamon. It contains a compound called coumarin that, in daily doses, places strain on the liver over time. That is not the one I am recommending, and that is not the one the research supports for blood sugar management. The variety you want is Ceylon cinnamon, sometimes labelled as true cinnamon. It is lighter in colour, slightly milder in flavour, and it is the form that has been studied specifically for its effect on glucose metabolism. Here is what Ceylon cinnamon does inside your body that makes it worth your attention. It contains a concentrated group of plant compounds called polyphenols. These polyphenols interact directly with your insulin receptors, the same receptors that have gone quiet in insulin resistance, and help them respond more efficiently to insulin's signal. At the same time, Ceylon cinnamon slows how quickly your stomach empties after a meal, which means glucose enters your bloodstream at a steadier, gentler pace, rather than all at once. The Human Nutrition Research Center at the USDA published findings showing that consistent daily use of cinnamon meaningfully reduced fasting blood glucose in adults with type 2 diabetes. The amount needed was small, less than half a teaspoon per day. A quarter to a half teaspoon of Ceylon cinnamon daily is a realistic and effective target. Stir it into your morning oatmeal, add it to your coffee, or mix it into a smoothie. The most important thing is to pair it with a meal that contains carbohydrates, because that is precisely the moment when you want your insulin receptors performing at their best and your digestion slowing down. You can find Ceylon cinnamon at health food stores and many larger supermarkets. Look for the word Ceylon on the label. If it simply says cinnamon with no further description, it is almost certainly cassia. This is one of the lowest barrier changes on this entire list. It costs almost nothing. It requires no change to your routine, and the evidence behind it is solid. If someone in your family is managing their numbers right now, send them this video, because this is the kind of detail that never comes up in a standard appointment. The third food, and I use the word food loosely here, because it is more of a functional liquid, is apple cider vinegar, and this one has the fastest visible effect on a glucose meter of anything I am covering today. I want to explain exactly why, because this is not folk remedy territory. The science here is well documented. The active component in apple cider vinegar is acetic acid. Acetic acid works through two separate pathways simultaneously. First, it slows the rate at which your stomach empties after eating, which gives your body more time to process incoming glucose gradually, rather than absorbing it all at once. Second, it signals your muscle cells to pull glucose directly out of your bloodstream and use it as fuel, a process that happens independently of insulin. Dr. Carol Johnston and her team at Arizona State University conducted controlled research showing that consuming vinegar before a carbohydrate-containing meal reduced the after-meal blood sugar spike by approximately 20 to 30% in people with insulin resistance. That is a clinically significant reduction from a tablespoon of liquid that costs a few dollars. If you have a glucose meter at home, you can observe this working yourself as early as tonight. The protocol is straightforward. Take 1 tablespoon of apple cider vinegar, diluted in a full glass of water, 10 to 15 minutes before your largest meal of the day. Dilution is not optional. Acetic acid is strong enough to irritate the lining of your throat and erode tooth enamel if taken straight. Always dilute it. Choose a variety that is raw and unfiltered, with what is called the mother still present. That cloudy sediment at the bottom of the bottle, that is where the active compounds are concentrated. One critical caution: if you are currently on blood sugar medication, adding apple cider vinegar before meals can cause your glucose to drop faster than your medication accounts for. Monitor your readings and loop your doctor in before making this a daily practice. We have covered 3 foods so far, and each one works through a different mechanism. Bitter melon activates insulin pathways directly. Ceylon cinnamon wakes up the insulin receptor. Apple cider vinegar slows the glucose flood and helps your muscles do the cleanup work. The fourth food does something none of the first three do. It addresses the problem that happens while you are asleep, the one responsible for a high fasting reading in the morning, even when you have not eaten a single bite since dinner. If that sounds familiar, pay close attention to this last one. The fourth food is broccoli sprouts, not mature broccoli. The small, thread-thin, 3-day-old sprouts. That distinction matters more than most people realise, and skipping past it means missing almost the entire benefit. Here is why the sprouts are different from the full-grown vegetable. Broccoli sprouts contain a compound called sulforaphane. Mature broccoli carries some of it, but the sprouts contain between 50 and 100 times more of the same compound per gram. That is not a small difference. It is the difference between a food with a mild supportive effect and one with a measurable clinical outcome. Now here is what sulforaphane does that none of the other three foods on this list do, quite as directly. It travels to your liver and quiets down what researchers call hepatic glucose production, your liver's overnight sugar-making process. Under normal circumstances, your liver releases a modest amount of glucose into your blood during the night to keep your energy stable while you sleep. But in someone with insulin resistance, that overnight glucose factory runs too hard and produces far too much. The result is a fasting blood sugar reading in the morning that is higher than it was when you went to bed, even though you have not eaten anything. This is one of the most frustrating and confusing experiences for people managing blood sugar. You do everything right the day before. You eat carefully, you rest well, and you wake up to a number that makes no sense. The liver is the reason. A clinical study published in 2017 out of Lund University in Sweden gave concentrated sulforaphane to participants with type 2 diabetes. The results showed a measurable reduction in fasting blood glucose E, with the most significant improvement in exactly the patients whose numbers had been the hardest to bring down through other means. That is not a coincidence. It is a mechanism. And broccoli sprouts are the most accessible way to put that mechanism to work. You can grow them yourself on your kitchen counter in a glass jar for pennies, or find them in the produce section of most health-conscious grocery stores. A small handful, roughly a quarter cup, on a salad, tucked into a sandwich, or stirred into eggs is enough. The key is to eat them raw or very lightly wilted. High heat destroys sulforaphane. Do not cook them hard and expect the same result. Add broccoli sprouts to your evening meal in particular. Given what they do overnight in the liver, that timing puts them to work exactly when your body needs them most. I want to tell you about a patient I will call Margaret, 67 years old, retired school teacher. She came to me after her doctor told her that her A1C had climbed to 8.1, firmly in the diabetic range, and that they were going to need to discuss adding a second medication at her next appointment. Margaret was not someone who ignored her health. She walked every morning. She had cut back on sugar for years. She was trying, but her numbers kept drifting in the wrong direction, and she did not know why. We did not overhaul everything at once. We started with 2 changes: broccoli sprouts with her evening meal, and apple cider vinegar diluted in water before lunch. Within 10 days, her morning fasting readings had come down noticeably. We added Ceylon cinnamon to her breakfast routine, and bitter melon twice a week as a cooked side dish. At her 3-month follow-up, her A1C had dropped to 6.8. Her doctor reduced her medication. Margaret told me she had not changed how much she ate, she had changed what she added. That is the principle behind every food in this video. You are not restricting. You are equipping your body with what it was always missing. Let me bring all 4 together, because the reason they work as a group is worth understanding. Bitter melon gives your cells an alternative pathway to absorb glucose when insulin resistance has blocked the main one. Ceylon cinnamon helps your insulin receptors grip that signal more firmly at mealtimes. Apple cider vinegar slows the glucose from arriving too fast and helps your muscles handle what does arrive. And broccoli sprouts address the problem that happens in the dark: the liver producing glucose overnight when it should be resting. 4 foods, 4 different entry points into the same problem. Stack them together and your body gets support at every stage of the blood sugar cycle: after your meals, between your meals, and while you sleep. Before you start, one important word of caution. If you are currently taking insulin, metformin, or any sulfonylurea medication for blood sugar, these foods can work powerfully enough to lower your glucose faster than your current dose accounts for. That can push your numbers too low, which carries its own risks. Do not stop any prescription on your own. Instead, bring this list to your next appointment. Ask your doctor to monitor your readings as you make these additions. The goal is to let your body improve to the point where your doctor can walk your medication down, not to do it without them. Here is exactly what to do, starting today. Tonight, check that you have apple cider vinegar in the house. If you do, dilute 1 tablespoon in a full glass of water and take it 15 minutes before your dinner. Tomorrow morning, add a 1/4 teaspoon of Ceylon cinnamon, the real kind, labelled Ceylon, to your coffee or oatmeal. This week, find broccoli sprouts at your grocery store or health food shop, and add a small handful to your evening meal at least 4 nights. And within the next 2 weeks, try bitter melon, fresh from a Caribbean or Asian grocery, or in capsule form, if the fresh variety is not accessible to you. You do not need to do all 4 perfectly on day 1. Add 1 at a time, let your body adjust, and stack them in gradually over the coming weeks. If this video gave you something useful, something your last appointment did not, please subscribe and share it with someone in your family who's managing their numbers right now. The information in this video took years of clinical experience to put together. It should not be this hard to find.